Here is a case of very large prostate gland, ultrasound showing 130 grams. This is a cystoscopy picture. Very large gland without much median lobe. Now you can see while coming back, thick gland in fact. So always we start at the Veru region, para-Veru, because the gland will be less here and capsule is reached within no time, and gentle sweep is done only at this point of time where maximum gland gets separated easily, and this can be done only in the base of the posterior part of the gland, not anteriorly, because the sphincter will be there. Once the plane comes like this, most of times we use laser nowadays than the mechanical, like this, anteriorly we will come. Now totally we came anteriorly now, completely encircling. Now we are coming on to the right side of the patient, same steps by the side of the Veru. The gland is rotated. Only this part we use little bit of mechanical. After that the most of the dissection will be with the laser. And one more thing, in this we have used a little higher wattage laser, 2 joules energy. See, this is a retropubic region where the fibers are clearly seen. When compared to the holmium in thulium fiber laser, some amount of charring will be there, but with little gentle traction, immediately fibers will be seen. So every time you can be in plane with less bleeding. That's why the learning curve is slightly less. But only some, see like this, initially appear wherever you touch a little more time, the charring effect will be there. But little movement also will get the capsule back. So that way the confidence while during the surgery will be there. So on either side we are releasing the gland now anteriorly. This type of large glands, some amount of bleeding is expected. It won't be completely avascular. But when compared to TURP, this bleeding is less, and coagulation efficiency of the thulium fiber laser, see here, so many vessels at the capsular level gets coagulated easily. The coagulation power of the thulium fiber laser is very good. That's why too much loss of vision will not be there. Large vessels also can be coagulated, and you can correct where you are and you can immediately come back. This is at the 12 o'clock position. It was very, very large gland. 1 or 2 times we missed the plane also. Then they can be reconnected easily, because at 2 joules 20 Hz it cuts so fast and you can reunite like knife, it cuts. This is at the bladder neck region. Laterally we are dropping down, and majority of times if the laser fiber is 12 o'clock, surgery will be better. This we are now, I am cutting at the center to divide the lobes, because now see I am separating the right lobe from the posterior aspect, that is at the 6 o'clock position. So doing this way and that way, in the initial part the orientation will be there, and slowly by pushing the gland after releasing both anterior and posterior. The difficult part is mainly when you come in the middle lateral part, where from the anterior and posterior, if you combine, then only the surgery looks smooth. We had difficulty in this case, that's why we are sharing also. Sometimes we lost, but never lost the control. once the one lobe is done, doing the other lobe is very easy. See, the quite clear capsules are seen till the end. Now at this stage, when the gland is completely pushed but still it was hanging, the trick is you stretch the gland into the bladder, and whatever the stress tissue like this anteriorly was there, little bit of the gland was there. So we finished this hanging one, and then it has gone inside. Now the left lobe of the patient is done. Usually it takes less time because you'll have space, and this surgery took around 2 hours 10 minutes. In fact, 138 grams was the weight of the by weighing machine. Some amount of water also may be there in that, but patient post-operatively did well with good flow, as well as almost no incontinence from post-op day 2 itself. Urgency was there 1-2 days. After that, hardly any complaint was there patient. Because of the early sphincter release, slowly we are gaining confidence to do these big glands also. There are certain advantages and disadvantages of the thulium fiber laser. Main advantage is no bleeding. Disadvantage is, by chance if you cut in a different plane also, it looks like you are in a plane. That is a major disadvantage. So you have to come back to the original plane and then properly recorrect. If you don't recorrect, the gland will become 2 pieces, and which piece is correct you will not be able to tell. Usually that part will not be there in, people say will not be there in homium, because it is difficult to carry further if you are in a wrong plane. So for a junior, doing somehow is easy with thulium fiber laser, but as the experience increases, this somehow will go, and proper channeling occurs. So at the end, we were happy with the coagulation. A little bit laser coagulation is also done. We use a starch marcelator, which is okay. By keeping, one small trick we learnt is while doing the marcelation, keep withdrawing towards the bladder neck, so that the chip will not go again and again into the bladder. Actually, this surgery we have done during the 4th Saturday workshop, where 20 urologists were there along with the RIRS, and patient post-operatively had this 138 grams weight and did well in terms of incontinence as well as urine flow. Thank you.